Hey everybody, it's Dr. Greg Gillespie. Last year, a couple of my buddies said, "Wait, Dr. Greg, are you telling me you don't have an intraoral scanner yet?" Well, the good news, everyone, is that I got one. The bad news is that with new tech comes new problems. One of the problems we have as clinicians when we try to incorporate new technology into our practices is that the new tech and the new devices don't always talk well with the old tech and the old devices that we use on a daily basis. And so it's hard to incorporate them or use them in treatment planning or in patient presentations right away. CableCur has actually come up with a new platform, one platform that houses everything. It's called DTX Studio. And this platform now takes your intraoral scans, right? The new ones that I got, right? Intraoral scans, 3D imaging, 2D imaging, intraoral photographs, extraoral photographs, all in one platform. The first thing I love about this is the 2D and the 3D imaging on one screen, right? Before, I used Anatomage for my 3D imaging, right? And I used DEXIS for my 2D imaging, so I'd have my bite wings and my PAs, and then I would have to have a separate screen or a separate software going that I'd pull up to do my treatment planning and my patient presentations. But now I can toggle back and forth, or I can have them in one window where I can look at it all at the same time. The second thing I love about this is the ability to drag and drop. I'm telling you, this is great. I love beautiful extraoral photography, right? As do many of you. I've seen your photographs, but one of the hard things is to get those images into the patient's chart very cleanly, nice and easy to be able to see at the same time. Now you can just actually take those images, right? You can just drag them from your folders on your desktop right into DTX Studio, and then you can have them all in one place. It's really fantastic. The third thing that I love is the ability to take your intraoral scans and not just have them on your scanning machine, right? But you can have them in the same platform as you have your bite wings and your PAs and everything else. So I bought a prime scan, right? And so normally you'd have to wheel the prime scan into each operatory to show the patients some of their old images. But now you can actually export those files right into DTX Studio so they can be housed in the same area as everything else. And so then when you're doing treatment planning, patient presentation, it's right there for you to toggle back and forth and show the patient what you're trying to teach them. The fourth thing that I love is the ability to take your treatment planning software of your implants and then export them right into the software you're going to use to place the implants. So you have DTX implant right incorporated into the same platform. The other week I had a patient come in and he had a number of issues, right? We were missing tooth number 5 and that was the big issue for him. He wanted to make sure that he had a tooth that he could put back in number 5. The problem is that he had lost it years ago. So we had some bone loss. So we took an intraoral scan, right? I took a 3D image, of course. I had a PA and a bite wing. We're checking for decay as well as extraoral photography. So I was able to incorporate all of those images into one platform, started to do some treatment planning. One thing we had to figure out was how many teeth were gonna go in that space, because he had actually lost 4 and 5, but 3 had moved into that space, right? One of the cool things about this software is that you can actually have a smart function where you're clicking on one tooth and then all of the images for that tooth, let's say tooth number 5, will come up in one screen. So you can see the cone beam image, you can see your 2D image, you can see your extraoral photography that you've marked, and so that is all on the same screen. And that's really nice for treatment planning and for patient presentation. So the patient came in, we talked about what we were gonna do, we figured out we were gonna just place one implant. So we figured that out in DTX implant. I planned it there, I exported it to my live navigation software with the X-Guide software, and then I was able to essentially place that implant exactly where I wanted. The surgery went great because it was a difficult spot, right? It had to be in the exact space because of the bone loss, but we were able to get it just where we wanted. It was really, it was a smooth transition, something I really was impressed by in this new software. So for all of us who love all the tech in our practices, if we could just incorporate it into one platform, that's what this does. You should definitely check it out. Thanks so much.